Hello, everyone. Welcome to the Veterinary Business Podcast, your ultimate resource for developing a successful veterinary practice and career. I'm Dr. Amanda Landis-Hanna, one of the co-hosts of the Veterinary Business Podcast. On this podcast, we bring you insights and expertise from industry-leading doctors, experts, and thought leaders. We cover a wide range of topics, including practice management, marketing strategies, leadership development, HR best practices, and much more. Whether you're a practicing veterinarian, a practice owner, practice manager, or a student studying to be a veterinarian, this podcast is tailored to help you navigate the unique challenges and opportunities in the business of veterinary medicine. Every listener of this podcast is welcome to visit us at our website, www.veterinarybusinessinstitute.com, for additional resources and tools to support your growth. And remember, you can subscribe to our podcast on iTunes, Spotify, and other popular podcast platforms. Today, I'm very excited to talk to Albert Di Rienzo, President, Founder, and Chief Innovation Officer of One Health Group, makers of Voice. Today, we're going to be speaking about AI in your practice, specifically the Voice platform. Let's jump in. Before we get started, Albert, why don't you take a minute to tell us a little bit about yourself? Who are you? How did you get into the world of veterinary medicine and the veterinary industry? Tell us a little bit about your story.
Great. Thank you so much, Dr. Amanda. It's a real pleasure to be on the podcast. As far as myself, my background, I used to be a professor of forensic science at the Forensic and National Security Sciences Institute at Syracuse University. Primarily in the research, I wasn't so much teaching lectures or classes, and I focused on chemical, biological, radiological, and nuclear threats actually to America. And I also am degreed in computer science, mostly on the side of intelligent computing or artificial intelligence. I have over 30 years in human medicine, and as most people I'm sure listening to this podcast know, you never really do anything on the human side without first making sure it's successful on the animal side. And so I have a passion really for marrying the animal and human world, as we all know, One Health. And that really became a focus of mine as part of the National Biodefense Science Board. And I've continued with that passion because there's learnings to have on the animal side, the human side. Let's fuse those data sets and come up with new predictive analytics to keep both animals and humans safe, healthy, which are really intrinsically linked. So hopefully that's enough of a background.
Absolutely. Can you share any of the standout experiences or lessons that have influenced your path in the world of tech startups?
Oh, wow. That's a great question. So this is my fifth startup. I've had three other successful exits. All were in the human medicine side. One, we just decided not to launch. It was not the opportune time to really raise the money and move it forward. So my passion has always been in that innovation space, but that innovation that's solving real world problems and bringing good to what we're all about: taking care of humans, taking care of animals, taking care of the planet, and so forth. And so the experiences I've had there, they've been pretty diverse: academic, industry, and government. I've worked with big corporations like Philips Medical Systems or Siemens Medical Systems, worked for the federal government and national biodefense. I was one of 13 scientists selected to participate on that for under two different presidents. And then I also have a number of, again, in the academic side on the forensics area. But what I can tell you is I've done some pretty neat sensor technology for human applications, whether in hospital, remote, or even monitoring soldiers that are deployed in the field. And then also gotten involved with infectious disease, chronic disease management, And really, again, if you look at, and we can talk more about this later, but if you look at voice, it's sort of the marrying of that intelligent computer, the sensor technology, cloud computing, big data analytics. So I'd say that those are sort of my experiences and my passion. So I'm an old guy. I've been doing this for, over 35 years.
I'm so excited to be talking with you about this. You mentioned voice. Obviously, I'm really excited to be speaking with you as the Chief Innovation Officer of Voice. Can you tell us a little bit about the workings of the sensor, cloud-based dashboard, as well as the mobile app as applied to different types of animals and different environments?
Yeah, absolutely. So first, I'd like to say I am very honored to have Dr. Amanda as our chief veterinary officer. She recently came on board. She's got 22 years of experience and very diverse experience. And she's been involved with voice from the earliest stages. So it's a real blessing for the company to have Dr. Amanda as our chief veterinary officer. So you're going to see a lot of great things from her. As far as the voice sensor, it is really the primary data acquisition mechanism is ultra-wideband radar. And we use that to safely and securely and in a very small package collect anatomical, contextual, functional, and physiological information that is unique to the particular animal. So we collect that data. We can tell you based on other sensors that are incorporated in the overall voice package what that animal was doing at the time of data collection. We take that information, we send it to the cloud. We have predictive analytics. So there's machine learning algorithms in the cloud, and that cloud is a way that the data gets collected, the algorithms go to work on it, and that data gets presented in a very friendly manner to the veterinary professionals. And what I can say is we already have over 1 million hours of animal data that's collected. We have it on cats, dogs, rodents. We've done horses. We actually have goats. We've even done 2 human studies. And so we really drive those algorithms and alerts that come from the data that's collected where an animal may be in jeopardy based on species, breed, age, weight, and sex. So you'll be able to get the data also on the mobile app, and you'll get alerts on your mobile app. And it's very intuitive, very user-friendly. I can tell you we collect almost 4 billion samples a second. And it's not like we inundate the veterinary professional with all of that information. We actually present it in a very user-friendly way.
The idea of One Health, connecting those dots between human and animal health, is really fascinating. As you mentioned, you've got tons of data on animals as well as some human data. How does voice really bring that concept to life through the technology? There's been some pretty eye-opening discoveries about the relationship between animal and human health, as well as the environment. So how does that One Health sort of structure come to play through voice?
Yeah, that's a very excellent question. It's a little bit of a big question, but when you think of One Health, about 7 out of 10 infectious diseases that animals get make the leap to human. So the animal ones are zoonotic diseases. The ones from environment are typically vector-borne diseases. And so you can think of things that come from ticks or mosquitoes or fleas. And those have actually gone up tenfold over the last decade or so. Just like the zoonotic used to be 6 out of 10, now it's 7 out of 10, so it's continued to grow. And then if you think of chronic diseases in just our companion animals, but it also impacts other animals, about 70% of the things that humans get, type 2 diabetes, congestive heart failure, things of cancer, things of that nature, they impact animals. And so the whole idea behind One Health Group is to collect that data on both, under controlled circumstances. So you would register the data, meaning that things that happen on the human side at a particular time and on the animal side, when that occurs. You fuse those data sets, and these can be very big data sets, but you fuse those data sets, and then you have the machine learning algorithms go to work on it. to see what are the commonalities. And the whole goal is really true personalized medicine or personalized health. That term usually has a connotation to cancer. You think of personalized therapies in cancer, but we're looking to bring this in the biggest sense to personalize health of every individual, which is really what voice is doing. It's what we collect is unique to that animal. By the way, something I should also mention, voice doesn't actually have to touch the animal. As long as we're within, 6 to 8 inches of the animal, we can collect some amazing data that we can then leverage on both the animal side and the human side. I will say one last comment. We're leading with animal first. That's our top priority. And then we'll eventually move to human, 4 or 5 years out.
Excellent. Obviously, on this veterinary business podcast, our primary concern is the animals, but certainly when we're talking about the human-animal bond, as well as One Health and One Health implications for animals and the humans that love them and feed them and take care of them, that's going to play a big role. I'm curious about how the voice sensor actually works. You mentioned ultra wideband radar. And of course, there's certainly some ideas that I have when I hear about radar. And I've learned so much working with One Health Group about ultra wideband radar specifically. Can you break down in simple terms how the sensor collects and interprets data, especially how it has this unique ability to distinguish reflective signatures within an animal's body and capture really precise motions?
Yeah. So ultra wideband radar, a lot of times when people hear radar, they think of radiation, and that's not the case. Or they think of radar in the sense of what, tracking an airplane or ground control in an airport. So there's some things that are analogous, certainly to regular radar. But what we do is we operate in the 3.7 gigahertz range. Which is actually part of 5G. So everybody thinks, oh, my phone is 5G, and we're a very small portion of the 5G spectrum. That sensor sends signals into the body. They're radio waves, much like ultrasound sends sound waves into the body. Now, ultrasound, those sound waves reflect after they hit different structures in the body. The same thing with these radio waves. We're actually penetrating the body, and these sound waves impact whether it's skin, muscle, it can be an organ, it can be blood. And that data, as you mentioned, it reflects, that information reflects. The interesting part is every part of the body has a unique, what we call a dielectric reflection. And that reflection is, we can interpret that. So your heart has one reflection, your brain would have another, blood would have another. And so we know exactly what we're seeing based on that dielectric reflection. And when I say seeing, I don't want to mislead anybody. We're not getting an image. We could if we had multiple receive and transmit antennas, but then that has the cost go way up, power consumption, so forth. So we've kept this simple. So that data gets reflected. Some of the radio waves get absorbed, some get scattered, some gets reflected. We can read that reflected signature, so we know what we're looking at. On top of that, we have 256 range bins, and this is where it's sort of like radar. When you think of, oh, I'm tracking an airplane through the sky, how close is it to the airport? We have 256 range bins, which are almost like slices into the body. So we know where we're at in the body. We can see where it's, oh, this is the start of a cardiac signal. We're getting close to the actual center of the heart. Oh, now we're getting great signal. We're right in the center of the heart. And then you can see where it starts to trail off. And so we know where we're at in the body. And so let's say we're 4 or 5 inches away from the animal. We're not touching it. We know that we're in air, so we don't even start collecting that data, and we can tell when we start to hit fur, for instance, and then because that has a unique signature. And then the final thing, which you actually mentioned, is the motion. We can pick up motion down to a millimeter, even a little bit less, so we can see a carotid artery pulsing, for instance. We can see the lungs expanding and contracting. And so the beauty of ultra wideband radar is it's very rich, data rich. It's very nice signals. So we can even pick up data under motion, which is nice. Not a horse at a full gallop, but if an animal is moving gradually, we can pick that up. Again, it's very safe. So no harm is done to the animal whatsoever. It doesn't create, like ultrasound, if you left it on for a long time, you're going to get heating to the body. Also, ultrasound can't go through bone, can't go through air. We go through everything. And so it's a really nice, low-cost technology, accurate technology. And the final point I'll make, you think wireless. Oh, is my cell phone going to interfere with it? Is Wi-Fi or Bluetooth? Ultra wideband radar is what we call below the noise floor. And so where Wi-Fi, Bluetooth, and other wireless technologies, they're at much different frequencies, and the way they operate is different. We don't interfere with them. They don't interfere with us. Matter of fact, in our sensor, we have over 3 different types of radios, all in the same, 1.5-inch package that don't interfere with one another. So hopefully that gives some sense to the listeners as to how ultra wideband radar works.
Absolutely. And I'm sure our listeners want more information because you mentioned different body parts that exist, obviously, in different aspects of the body, including potentially not touching the animal. The carotid artery doesn't live where the heart lives. So can you break down and kind of describe for me, if you're standing a couple inches away, how do you collect, say, for instance, heart movement versus carotid artery movement? Do they need to be, does the sensor need to be held or located in different areas in order to collect that kind of data?
Yeah, I appreciate that question because my response could be misleading. So, for instance, if you want to collect from a collar, the voice sensor can attach to a collar or a harness. And so let's say you're on the collar, well, you're going to get the carotid artery. So you're going to get heart rate, you're going to get rest rate, because you can actually see movements of the throat expanding and contracting, even of things like the esophagus. You're going to get animal motion as well. We collect a lot of contextual information, but you're not going to get lung fluids, or you're not going to get heart wall thickness, because the way the radar works is we have something that's considered a cone beam. So it would be like an ice cream cone. And so we can cover, goes out like the shape of a cone, and we can cover between 3 o'clock and 9 o'clock. So about 180 degrees at the peak. And so if you're several inches away from the animal, it's still going to be within that cone beam. If you're over the heart or over the chest, let's say attached to a harness, then you're going to get heart, lung information. You'll get some digestive, organ type of information. You can even get, if there's fluids in the lungs, you can see those types of things. The other thing that you touched on is you can actually have this in a handheld. So it can be worn by the animal, but the veterinarian could also use a handheld where they could place it over the region of the body that's of interest to them. Because the other thing we can do is detect masses in the body. We can't tell you if it's cancerous. We could tell you if it's a lipoma, but we can tell you there's a mass that doesn't belong there. And that's what our study with Johns Hopkins was. We were actually monitoring lung tumors during radiation oncology, radiation therapy in humans, and we could track the motion, the shape, the location of that tumor to make sure the radiation stayed completely on that tumor. So that's a little bit, how that works and how you get that information.
That's really exciting. There's not necessarily really great ways to have early detection for masses or tumors in the animal body. So I just want to be clear. Are you saying that potentially either in the immediate or in the future, this could potentially be a technology to have early detection of changes, potentially, mass detection, or other changes like early indicators for heart disease or other types of preventative care testing?
Yeah, absolutely. So the mass detection won't be out with release one, but we have about a 5-year product roadmap of different releases, and we're primarily focused, at least in our first release and the two successive releases, primarily focused on cardiopulmonary. And we'll probably have two releases a year, and those releases don't impact the hardware. It's not like the veterinarian has to get a new sensor every time. They're really cloud-based algorithmic changes and firmware changes to the sensor. And so we absolutely will look to bring these other technologies to the market, or these other solutions. Further along that product roadmap is disease progression or disease detection. So let's say there is the start of some sort of liver disease. The liver, a healthy liver, has a particular reflected signature, a dielectric signature. So you know the tissue is healthy. It also has certain mechanical properties, sort of tissue elasticity, you might say, or organ elasticity. But now, if the livers becomes diseased, and there's depending on what the disease is, there's different sort of stages, typically stage 1 through 4. All of a sudden, though, the liver starts to change. The properties of the liver start to change. So now its dielectric reflection changes. And so we can see that the liver has gone from healthy now to stage 1 of a particular disease. And you can see the progression of that as the liver, or whatever organ it is you're looking at, continues to change. Now, obviously, all these things, the reason we can't roll everything out day one, they're going to take big studies with veterinarians. We don't release anything unless the veterinarians say it meets industry gold standards. So what they're using to determine things today, certain disease states, we would be compared to those, and we need to be as good as or better than. And there may be some areas where there might not be an existing tool that we're going to need to go through studies. So we don't want to put anything into the veterinarian's hands that hasn't been proven out. So, but I got to tell you, it's a really exciting future of the types of things that we can bring to bear, whether in clinic or remotely.
Excellent. It's so futuristic sounding in some ways because we don't have technology like this right now. Obviously in veterinary medicine, we have some technologies like lab work as well as imaging, whether that's radiographs or ultrasound. Unfortunately, not every patient can get a CT or an MRI if we start to see evidence of issues. You mentioned that the technology itself is relatively low cost, but obviously I would expect that we're going to potentially have some implications on the cost based on things like battery life or what kinds of attachment processes we're talking about. You mentioned a collar, you mentioned a handheld. Can you tell us a little bit more about what kinds of concepts you're looking at maybe for that first release? You mentioned a couple of releases per year. Are we thinking along the lines of starting with one type of attachment for the pet to be used, when difficulty of use? Can you give us some more kind of ideas around what we should expect to see in the near future versus the further future?
Yeah, absolutely. So upon release, the sensor, which is about the surface area of a quarter, and if you stack $1 worth of quarters, that's about how thick it is. It weighs about an ounce. And it will attach securely and safely and easily to a collar or a harness for cat or dog. Those are initially what we're focused on, and then we'll bring other species and breeds on further down the line. Like most early stage companies, the more funding that we receive, because we've self-funded for a number of years, and then we've also leveraged investment. The more aggressive we are in our fundraising, then potentially we would also have a handheld version upon release. If not, it would be within 6 months afterward. There's also, because it is battery operated, as you mentioned, so there is a charging solution that goes with it. And then we can also run off of wall power, which is, again, something that comes into play further down the line, where this might be used to monitor the health of dairy cow while it's being milked. Because we don't have to touch the animal, we could be integrated in and they don't ever have to worry about replacing a battery. So we can run on wall power. The other solution that'll come out very early is what we call a gang charger. So a veterinarian, if they had 5 of these, they're not going to want to have 5 separate chargers plugging into the wall to charge this solution. And so the gang charger would allow you to have up to 10 sensors all charging concurrently. It saves space for the veterinarian. It saves, the clutter that comes with that, the cable management issues. So we're trying to make sure that we're very receptive to the voice of the customer. Voice has been designed, just so you know, not by a bunch of geeks like me. It's been designed with the help of veterinarians and animal health professionals, because they're the target audience, and they're the ones who are dealing with these problems that we're trying to solve.
Excellent. So you mentioned that it was designed by veterinarians. I'm going to dust off my shoulder here a little bit, since I was there at the beginning and was lucky enough to have a little bit of influence on it. But when you're talking about the target audience being veterinarians and animal health professionals, are you saying that this is going to be used by the veterinarian? Or are you expecting that some of our pet parents and clients are going to be using it? Is it designed more for short term, for long term? What is sort of the vision for, say, for instance, how the initial release might be used?
Yeah, it's a good question, and we are a B2B company, so we don't go direct to consumers. We are working with the professionals. So it could be used in any number of ways within the veterinary clinic. It could be used as a spot check device. It could be used for collecting baseline on an animal that you could compare year over year, in an emergency department to do rapid triage on an animal. It could also be used pre-surgery, post-surgery, and I'll talk a little bit more about that one. We do have a lot of requests to use this during surgery, because we can stream data in hard real time that can be seen immediately. On the post-surgery side, the solution would go home with the animal to whatever the vet decides, 7 days, 10 days, whatever it may be, where it would be worn by that animal, and the pet parent would get some general health data on their animal, as well as any alerts. And then the veterinarian can also make sure that the animal is recovering the way that they believe they should be. So this is a great way to ensure compliance. And when the animal is not under the veterinary's immediate care, the veterinarian can see what's going on. Other areas, let's say you have an obese cat and you want to have the cat on a weight loss program. It might go home with that cat for several months under that weight loss program, because we do detect calories expended, distance travel, activity levels, sleep quality, things of that nature. And then maybe an animal's dealing with a chronic disease, maybe a canine is dealing with a congestive heart failure issue. It could go home with that animal again to try to make sure they're staying within whatever parameters the veterinarian decides and thinks is best for that particular animal. Just as a sidebar, one thing I didn't mention earlier, we have something called care flows. And those care flows, again, are selected by the veterinarian. So that when we went out to a study, we had over 20 care flows that came up from the veterinarians. And those determine what data gets collected, how often it gets collected, and what gets sent to the veterinarian, how often it gets sent to the veterinarian. It also detects or sets thresholds. When should an alert be triggered? And in order to keep that animal safe and that animal healthy. So these care flows are really quite powerful. The veterinarian can modify them, they can create their own, and actually they can change them on the fly over the air to the sensor. So it's pretty exciting to see. So these are things planned for our first release.
That is super exciting. Veterinarians like myself, we love data. At the same time, we don't want to necessarily be inundated with data. It's obviously going to be a learning curve to learn how to deal with this influx of data that we haven't had before. When a monitor goes home with a patient, is it the expectation that the veterinarian is going to be checking the monitor 24 hours a day, 7 days a week? Or how should the veterinarian potentially approach that conversation with the client to appropriately set expectations?
Yeah, so the veterinarian should not have to monitor this 24/7. They will have a dashboard and they can see the animals that are being monitored. But what we do is typically, let's say, just for simple sake, saying it's everybody's green. So there's nothing that needs to be done because it says everybody's within the parameters that the veterinarian expected. Well, now if somebody turns yellow, one of the selections turns yellow, the veterinarian might want to keep an eye on that or have a vet tech keep an eye on that. But equally as important, the pet parent will also get some information. They're not going to get the drill down of the data, but they'll get the general health status. And if we see the animals trending in the wrong direction, then the pet parent would really be the first line of defense to say, you need to contact your veterinarian to make sure that your animal stays healthy. And then if an animal turned red, alerts triggered, and that means, get the animal to your veterinarian immediately. So the veterinarian can really look at the data on their phone, on a tablet, on a desktop, whatever they want, as often as is convenient for them, but they shouldn't have to babysit it. We're going to trigger alerts based on parameters set by the veterinarian. And because we collect data so often, and send that data out, they should get updated. Now there is the challenge of what do you do when you're out of wireless range. And so first of all, if the animal and the pet parent they lose connectivity, there's an alert that goes to the pet parent's phone to let them know you're moving out of wireless range or you're out of wireless range. Nothing's coming to your phone. All the data still gets saved on the device, and the minute they're back into wireless range, it sends that data. So we're trying to make sure that nothing is missed, but we don't want to overwhelm the veterinarian. They've got plenty of other things to take care of, and we just want to make sure that they can look at the data when they want to, and we alert them when there's trends that are going awry.
Excellent. So you mentioned green and yellow. So am I hearing you say that there's sort of a red, yellow, green trending type of display that the veterinarian will be able to see? Is that the same for the client? Will they also get sort of a red, yellow, green type of display?
Yeah, so for the veterinarian, everything is really presented graphically. So we want to show data, because it's a lot of data that's collected, and we don't give them the raw data. We give them processed data, but we show it graphically. And then if the veterinarian wanted to drill down and say, oh, well, for blood pressure, systolic is this and diastolic is this, they can do it. Otherwise, they can look and just say, it's fine. They're within the normal range. So we try to present everything in nice, beautiful, sort of bold graphics and put the power into the veterinarian's hand to drill down as much as they want to and manipulate the data as much as they want to. So we want them to be able to practice the way they want to practice. As far as the pet parent, they will get a general health status. So they're not going to see systolic, diastolic, they're not even going to necessarily get your cardiac is this, your heart, your lungs are this, we're going to give them a general health status and then just provide, the health status is green. Everything's good. The health status is yellow. You're starting to trend in the wrong direction. The animal's temperature is going up, for instance. And then as it starts, that trend continues and starts to approach red, then we're going to alert. We're not going to wait till the last minute, but we're going to alert at the threshold set by the veterinarian, and then they can get the animal back into the veterinarian. So yes, they have data, but no, they can't manipulate the data in any way. They can't change what gets collected or doesn't get collected, and they can't drill down. We're leaving that to the professional. This is a clinical device. It's not like so many of the other, where's my cat or dog located, a tracker type of solution. So this is a clinical solution.
Wonderful. So one last question for you. Can you share a little bit about how the voice solution is approaching the market? Especially, you mentioned funding. What are you guys looking at as far as strategic partnerships and how those partnerships can align with Voice's broader goals and vision?
Yeah, so initially we will be going to the market to veterinarians, and that is mostly through strategic partners. So we just signed a significant exclusive distribution arrangement with a multi-billion dollar Japanese pharmaceutical company called Afresa. They are going to have exclusivity to sell voice in Japan. And so we're working to have others like that in both, North America and other geographies around the world. We're also talking to some major distributors that work strictly with the veterinary clinics. And now we will take some things to market ourselves more in the niche space. For instance, there's some things that the government, agriculture dogs that are used by the government, to keep them healthy and safe. But most of it's going to be through strategic partners. And there's a couple models. One is they purchase the sensor, and then there's an annual subscription fee. And that subscription fee gives you access to all those upgrades that we talked about every 6 months. It gives access to the alerts, all the data. It keeps everything current. If there was any sort of defect, it would take care of that. And then the other is a pure lease model where they never own the sensor, but they do get, it is a lease model. They still get everything. It's one lease payment per year. And we find that actually government entities seem to favor that more so, and even some academic more so than some of the veterinary practices. But we're trying to keep the e-commerce model very simple and not make that burdensome for the professionals either.
Excellent. You know, it sounds very futuristic. So, what are you guys thinking timeline, or what are we thinking timeline wise as far as bringing this to market? Is this 5 years down the road, or can we expect to see something sooner?
Yeah, definitely sooner. So we've been at this a long time. It just takes a long time to collect the data, to run multiple clinical studies, and we've been in over 3,500 different sort of settings collecting this data on a number of animals. And then we've gone through multiple iterations of the technology, shrinking the package, shrinking the cost, shrinking the weight, and providing more sensing capabilities and more power to what we're offering. And so now we're on that trajectory for product release. And so we have a number of beta testers already signed up. We're going to do 500 beta units, which is pre-production units, and those are going to be tested by professionals in different settings. I'll say that would be first quarter of 2025. And then production release, everything, all the packaging, all the labeling, everything that's required and has been fully vetted, because we have to go through FCC testing, UL testing, some other government testing. All that will be done, and we're looking at that by the second quarter of 2025. So it'll release in second quarter. All this is gated, of course, by what levels of funding we continue to receive. We're doing quite well. We have a lot of interest. We have a lot of investment received. We've got money in the bank, which is great, and we're moving very aggressively to that release. So could it happen sooner? Absolutely. Do I think it'll run beyond that? I don't. I think that would sort of be the late date, would be second quarter of 2025.
Beautiful. So for any potential investors that are enjoying this podcast and/or the veterinary public at large, where can we find more information about how things are going timeline-wise, or any updates? Do you guys have a website?
Yes, we do have a website that you could go to, onehealthgroup.com, and it'll show the voice information. We don't have an investor portal yet, but what I can tell you is we are an SEC 506 Reg V company, so we file with the Security Exchange Commission. They know exactly what we're doing, how much money we've raised. And we are working on a portal. So we're, it has to be a qualified investor that invests in us. And the minimum investment, just so you know, is 25,000 if you're an individual, 100,000 if it's institutional. And I will tell you, the website is informational, yes, but we don't put a lot of specifics on there today. That will happen the closer we get to release. But if people want additional information, they can reach out to Dr. Amanda, or they can reach out to me, and we can provide them with updates. Just so you know, we're very well protected. We have over 70 patents already issued and 12 trademarks and about 4 trade secrets. So we're pretty free at what information we share, because the company is so very well protected from an intellectual property perspective.
Again, I'm so excited to be working with you and the rest of the One Health Group team, as well as all of our investors, our partners, the universities that we're partnering with. It really is quite a bright future. I am so grateful for your time today. I also want to take a moment to thank our listeners. We do appreciate each and every one of you that happens to be listening today. Definitely, we cannot do what we do without you. And if you like our podcast, please share it with your colleagues and your friends on social media. Also, please don't forget to leave us a review on your favorite podcast platform. Your reviews will help us find other veterinarians and other practice owners, as well as veterinary team members, veterinary students, veterinary technician students. The more people we're able to reach and the more feedback we get, the more tailored our podcast is going to be able to be and help serve you. So until next time, keep striving for excellence and making positive impact in the lives of your patients and your pet parents. I wish you all an amazing week ahead. Thanks again, Al. We'll talk soon.
Thank you.